we can use it. Another one, imagine that some injury happens to you at home. You are at home, you don't have any cold pack, ice pack. Don't be worried. You can use the freezed peas in bags. You know that? Do you know what is peas?
No.
Do you know what is peas? Search peas. We use it in salad on food. Okay, maybe in every home there is a freeze peas bag, or even if you find out meat or chicken is in your freezer, use it as an emergency. And first, you can use it as a cryotherapy. Actually, the temperature of them is more than cold pack. Okay, if you don't find anything, use meat, use chicken. Okay, at your refrigerator. Any other question? Is everything obvious for you? If you create a group, too many useful, videos, because at this class actually we don't have time to play all of this. Another one is cryotherapy flow. Have you seen? Have you seen that? In some athletes, it is so expensive. For example, one of the factory that has this kind of cryotherapy machine is from Zimmer from Germany. It's too expensive. In most of the clinics, especially sports orthopedic clinics, for example, Ronaldo, Messi, they use it for recovery. Okay, this is the cryotherapy. This is the flow of air, but this air is cold. And here another, it's like a tank. Have you seen a picture of Ronaldo in this tank? Okay. In Iran, there are some, I don't know, how many of you come to Iran, visit Iran previously? Just you? Yeah. There's a center in, IFMARC. IFMARC, it is related to the Federation of Football, okay? They have such a device. They use it for recovery of the athletes. Okay, it is expensive. But look at this. Another device. It's like a box. For different joints, we can use a different shape of cuff. Shoulder cuff, wrist cuff, elbow cuff, knee cuff, ankle cuff. They are the different shapes. After surgery, imagine a patient with ACL reconstruction surgery. We can use it. Not only it provides pressure, but also it cools down the tissue. Okay? Got it? Yes. For ankle surgery. Another one is immersion in cold water. Do you remember the example, pool with cold water? They immerse their limbs in their cold water. Most of the time, the temperature is about 16 to 18, but for not more than, for example, 20 minutes. Because they cannot tolerate it, especially if you are not allowed to use it for patients with heart problem, cardiovascular, problems. Another one, ice towel. You bring a towel and you bring a crushed ice. You mix the towel with crushed ice and put it over the limb. Especially in wrestling, they use it. Okay, but what is the disadvantages of this method?
Not for a long time.
Yeah, no, dirtiness. Imagine that the towel become wet. Can you use it in your clinic?
No.
No, actually the dirtiness. You know, because the crushed ice melted everywhere, it will be with water.
And you
Okay?
should be clean it everyone.
Yeah. Actually, and also another disadvantage, every 2 or 3 minutes you should change it with newer towel. Why?
The
Because
ice is
the crushed ice melted, it increased the temperature. Okay, you should need another towel. Okay, it's not time consuming,
And then
but you should, you should know that ice,
clean it.
towel. Another one, ice massage. You
Massage.
can teach your patient to do that at home. Look at that. The ice massage. Look at the shape. One of them is like this. Do you think is it the correct answer of correct way of application?
No, because
No, it is not correct. Now the hand of therapy is numbness. Okay, you need a tissue, or look at that here. You can make it at home. Bring a glass here and put it in the refrigerator and cut the top area. You can make it. Okay? And another one, look at that, consists of metal. If you put a metal in the refrigerator, the temperature of it decreases. It's too cold. Okay? You can use it not only for massage, and it's like a ruler. Again, you use it
By metal,
for
yes.
massaging the area, not only provide ice, but also. And here is the explanation. We use ice massage for 2 purposes. The one purpose is relieving pain, but don't forget this. We use it for 5 to 10 minutes, and we use it rotating or circular
With
movement. Okay, like that. Sometimes you teach your patient, for example, they have a tennis elbow or lateral epicondylitis, especially in tennis players or for women who are cook something, bringing kettle, they feel pain here. They ask them to do massage here over the lateral epicondyle. But for example, here, but what about sometimes you use it for neurological facilitation? For example, do you remember the quadriceps? You should find the nerve root and use a stroke. But look at the time of duration.
4 seconds.
4 seconds. It means that I wanted to increase the strength of my wrist extensor muscles. I massage like this, 4 seconds. Okay, so look at that. The movement is totally different. The time of the treatment is different. So for different purposes. But what is the disadvantages of this method?
Reduce the local pain.
Actually, advantages of it is local pain. For local pain, it's very good. But what is the disadvantages? Again, dirtiness, because the ice melted over here, okay? And another one, it is not time consuming sometimes, because the therapist should sit and use ice massage for 10 minutes. Because of that, sometimes we teach and educate the patient to do it at home to reduce the dirtiness and save our time, okay? Another one is evaporative spray. You have seen it in basketball match, volleyball, especially football or soccer. They use a non-flammable spray. So most of the time it's fluorometal. They spray over the injured tissue every 5 seconds for several times. Look at that. The distance between the spray and the tissue will be
45
centimeters. And and you should cover the eyes of the patient, and also you ask the patient to do not breathing, for some, because exactly. Do not splash into the eyes, and the patient do not. But if you use it in some sport match, about 2 minutes, there's a risk for freezing and burning that tissue and damage. Okay, look at that. They are cold spray. Are they using the
No,
good
wrong.
technique?
It's the wrong way.
Why?
Because it's more direct.
Because the distance is
Short.
very, exactly. And another, they should, splash or spray over the tissue in right angle, not, for example, this right angle, vertical to the tissue. Another one I haven't seen in Iran. I just find it in the YouTube and the, that textbook. I haven't seen this modality in Iran. Maybe you have it in Iraq. Look at that. This is the bandage, but it is not
Ice.
a common bandage that we use. There's some liquid. They mix the bandage with liquid and start bandaging the area. Look at that for ankle, for knee, for elbow. This liquid evaporates very fast. Because of the evaporation, our body, the temperature of that part decrease. Okay? Because if there is any sweat or water over your body for evaporating, it needs energy from your body. So the temperature, decrease actually. Not that.
Finally?
Let me check it. Okay, I told you. So this slide is I think the last slide, and this is very important. Selection between the heat and cold therapy. Let me check it by you one by one. For pain relief, which one can we use?
Better relief?
Heat or cold? For pain control, pain relief, which one can we use?
Depending on the situation, if it's for therapeutic purposes, we can use heat, but if it's instant pain, like a broken bone or fracture, we use cold.
Actually, for pain relief, we can use both of them, both heat and cold. But if it is acute case, if it is trauma, recent injury, especially about 72 hours after the injury, you are not allowed to use heat. Okay. For muscle spasm,
Cold.
Cool.
which one can we use, heat or cold?
Better is cold.
Cold is, we can use both of them actually.
Better is cold.
But again, according to the condition, if it is acute, again cold. But if it is chronic, we have acute stage, subacute stage, and chronic stage. In chronic stage, we can use both of them, but ask your patient which one she
Prefer, yes.
Okay, so for both of them. Another one, for spasticity, which one? Cold or hot bag?
Hot.
We can use hot bag for spasticity and have a local effects. We can use cold bag too, but
Sure. Not one.
exactly. Depends on the time of duration. That cold bag can increase or decrease, spasticity. The next one is recent injury or bleeding. If there is a bleeding here because of the cut, you put hot bag because you increase vasodilation. Okay, it is obvious. And another skin skilled movement. For a skilled movement. Yeah, you prefer heat, because the cold you cannot run, you cannot, grasp something well.
Muscle active.
For muscle strength, increasing muscle strength, cold actually, and for joint stiffness,
Hot.
you know that? Hot. For joint stiffness, yes, we prefer, heat therapy. Okay, but we can use cold therapy, but more than 15 minutes to have a vasodilation and responding, effects. Oh no, there are some slides. I think that the contraindication remains. Okay, but if we use cold bath for in wrong way and wrong technique, it is dangerous for the patient. You should think about the danger. There's a risk for severe damage if you use it. In this condition, you are not allowed to use it. You know that. Sometimes, if we use it for a wrong technique, there's a risk for burning, erythema of skin. Okay, there's a risk for fat tissue necrosis. Maybe you have you experienced very local eyes on your tissue? No. Sometimes there's a risk for burning and necrosis and death of the fat tissue, and sometimes frostbite occurs. In this condition, you are not allowed, there are the specific pathological condition, you are not allowed to use it. Look at that. Decreased peripheral blood flow. In some rheumatism, you are not allowed to use cold. Some patients have a cold sensitivity and also cold allergy. You are not allowed it, and high blood pressure. If a patient comes to you and said that I have a hypertension, please be careful about that. For especially for longer duration and bigger area. For example, if a patient have a hypertension, do you prescribe them cold pool? There's a risk for arrest. Heart attack. Okay? These are the decreased peripheral blood flow. Look at that. Vascular spasm. There are some diseases that we have was a constriction of the blood vessels. Vascular spasm. You know that you know the muscle spasm. Muscle spasm occurs in muscle. Vascular spasm, occurs in vessels, especially. Cold allergy. Vasospasm. It means that when we put cold here, we have a spasm of the vessels. Raynaud syndrome. I gave you a task for next session. I told you please search about Berger disease, and I remember I told you cystic fibrosis. Who searched about cystic fibrosis? I told you yesterday. You? What was cystic fibrosis?
Not me.
Okay, all of you, I will ask all of you. Because when you read,
انت
you
مش
should
موجود؟ Go.
search one by one. Raynaud disease, there are some syndrome or Raynaud disease or syndrome. In a case of cold weather, the tips of their fingers become red, blue, dark, because they have a vasospasm. In that case, you are not allowed to use cold. Okay, Berger disease, look at that, atherosclerosis. Patients have the, lipid or calcium deposit. Cryoglobulinemia, what does it mean? It means that there is a protein in the blood as a result of putting cold over that area. We have to destroy, the protein will destroy. Okay, but some patients don't know about this disease. Please ask them if you have a cold allergy. So maybe some of you, especially the white skin people, have this cold allergy. In the case of whether they have eczema in their hands, okay, be careful about that. And cold urticarial. Cold urticarial, it means that it is like an insect bite. Sometimes maybe you have you allergy to some foods. Have you experienced urticarial? You can search it. What is it? It's a rash. It's a like insect bite. After especially maybe the girls have this after eating some foods, there is a rash over the skins. Sometimes the people after cold they have a urticaria. You can search it right now. You can search it through your cell phones. Okay. In that condition,
What is it called?
search urticarial. They're the skin rash.
اه
Have you
اوكي.
searched that? Yeah, look at that.
حساسية
Can you
الجلد
spell it
المفاجئ.
in, we call it in Persian kahir. Yeah. Have you searched this? Show me the, yeah, it's like, look at that.
It's like a surprise allergy in the skin.
Allergy,
يلا تمام.
Allergy reaction.
Especially for patients with cardiac problem, don't put the local ice on their left shoulder because there's a risk for chest pain and angina. And in the case of high blood pressure, I told you, if a patient have prestalgia, for example, the patient comes to you, I have a numbness, prestalgia, you know that it is an improper sensation, especially the diabetic patients. You are not allowed to use cold back over that area because you know that the cold decreases the speed of nerve fibers. Their symptoms becomes more and more. And another, some patients have a psychological characteristics. You know that because especially in our cultures, because we are living in warm areas, all of the time we like warm. If there's a fire, all of us gather and try to, warm our hand. But is Canada, North Scandinavian countries is not like that. Because some of our, especially elderly people, are afraid of cold. They think that it's a sign of death.
A what?
What?
Sign of what?
Sign of death. Okay. Yeah. And it's despair. You know that it's hopeless. They become hopeless. You know that.
Yes, absolutely.
Yeah. Because of that, in some condition, we are not allowed to use. Maybe they cannot prefer. So sometimes you should ask the patient which one do you prefer.
Are you fear?
Not from cold, no, elderly patients. Because of that, sometimes they use more clothes and clothes sometimes because of that. Because look at that, it's
يعني أنت
psychological.
خايف.
Look at that, it's a psychological problem. It is, but some patients have this. And you will learn. For example, some patients comes to your clinic and think that, for example, they like pain, okay? They think that increase the device, increase it, but it is painful. You are not allowed to use. You should adjust it by your own. For especially electrical stimulation. Okay, any other questions? Is everything obvious?